Hello and welcome to our event. My name is Dr. Robin Zook, board-certified geriatric pharmacist. I'm here to talk to you today about medication therapy management, or also called MTM. What is MTM? Why does anyone want MTM? How would MTM be provided? And who pays for it? So what is MTM? MTM is a program or a service usually offered by specially trained pharmacists to improve therapeutic outcomes in individual patients taking medications, multiple medications or supplements, helping with their education and about the medications that they're taking, as well as the disease states that they are taking the medications for. All of this to help prevent adverse drug events and lower drug costs. There's a big group of services we call MTM. They are things like anticoagulation services if you're on warfarin, or going to the pharmacy and having the pharmacist ask you, have you had your Pneumovax shot recently, or your shingles vaccine? Those immunization services are also called medication therapy management, along with things like tobacco cessation programs or diabetes education. But the one thing that most people think of when they think about medication therapy management is complete medication reviews. And we talk about these things because medications cost a lot of money. The CDC, in between 2015 and 2018, has a lot of statistics about how many people take medications. 45% of the general population take at least one prescription drug a year, and that number goes up significantly as you age. 89% of patients over the age of 66 take at least one prescription a month, and 42% of those take up to 5 a month. And the more medications you take, the more adverse drug events you might end up with. Because, of course, you can't have an adverse drug event if you didn't take a medicine. But if you take a medicine, then it's possible that you would have one. Adverse drug events can lead to hospitalizations and emergency room visits, and these things cost money. And the more money we spend on this, the less we have for other social programs. In 2019, it was estimated that over $1,000 was spent on prescription drugs per person in the United States. So medication therapy management can help, as part of the reason for medication therapy management is to lower drug costs and medication costs, as well as just medical costs in general. But the top 8 reasons for having medication therapy management performed for you or having a complete medication review, the first is to help you understand your medicine and your disease state better. I always found that the more people knew about their medicine and their diseases, the more likely they are to take their medicines properly and help themselves with lifestyle changes, lower their disease risks. Medication therapy management can help you achieve your treatment goals. Treatment goals are things like you're lowering your blood pressure or lowering your A1C or blood sugar numbers. Also help decrease the number of asthma attacks. If you understand better how to take your asthma inhalers and asthma medicines, then maybe you don't end up at the emergency room for having an asthma attack. Reduce drug-drug interactions is another reason. Of course, the more older you are, the more medicines you take, the more likely you are to have drug-drug interaction. Oftentimes people taking over-the-counter medicines and they don't realize that they interact with the medicines that they're taking. So having a pharmacist look at that and help you pick the right over-the-counter medicine or the right herbal or supplement can help decrease that risk. Reduced harmful drug side effects. Some medications are just not meant for some people. And so one person may take a medicine and it causes lower leg edema or lower leg swelling, while another person can take that medicine and have no problems. So talking to your pharmacist about your medications can help you understand when you're having a drug adverse event versus not. Medication reviews can help you feel better about yourself, your health, and help you feel better. And the number one reason to have someone look at your medicines and do a complete medication review is to decrease your drug cost. One of the other programs that I often, when I was doing medication therapy management, I helped seniors make sure they were on the right drug plan. As seniors are on Medicare Part D drug plans, different drug plans have different costs. Your medicines may be the medicines that you were on when you were 65, when you signed up for your drug plan, are not likely to be the same ones you're on when you're 80. And if you're still on the same drug Medicare Part D plan that you were on at 65, you're probably on the wrong drug plan. So having an annual drug, checking your drug plan every year is really important to lowering your drug cost. The other thing medication reviews help do is stop a prescribing cascade. We call this the domino effect. This happens when you take one medicine and it causes a problem like constipation, and then you have to take a medicine to prevent constipation, and then that medication causes diarrhea, and so we have this long chain going on. Understanding that the first medicine was the problem to begin with would help prevent you from continuing on this medication cascade and taking another medicine and another medicine. There's a group of medicines that we oftentimes say, oh, that medicine, if you don't talk to the pharmacist when you pick up your prescriptions for your medicines to talk to them, they have to ask. In North Carolina, it's required that when you pick up a prescription, you're asked every time, do you have any questions to speak with your or would you like to speak with your pharmacist? The answer to that question should always be yes when you're picking up a brand new prescription. Yes, you can read all the side effects, but if oftentimes that prescription label that has the package insert is so small, taking the 3 or 4 minutes to speak to the pharmacist about the new prescription, why you're taking it, how to take it, what is it called? Lots of times these names are really complicated, and if you can't say it, it's hard for you to tell the next doctor that you go to that you're taking this medicine. A lot of medicines have similar names, and you don't want to say you're taking metoprolol when you're actually taking metformin because they're used for 2 different disease states. The doctor may think you have high blood pressure when you actually have diabetes. So knowing what the name is called, knowing its most common side effects, and how long are these side effects going to last? Sometimes medications, for instance, metformin, typically causes diarrhea the first week or so that you take it. And you should take it as in, the pharmacist can tell you how long to expect this diarrhea. And most of the time, people take a medicine, it causes upset stomach, and then they go, oh, I'm not taking that medicine anymore. It's causing I'm allergic to it. You're not allergic to it. It's a medication side effect that we expect to happen. And just knowing that, but metformin is really good medication used for diabetes, and it's usually the first-line therapy. So most everyone who has had diabetes has been on metformin and can tell you that, yes, it does cause diarrhea for the first little bit, but it does go away. But being prepared is very important. So how is medication therapy management performed, or a complete medication review performed? Specially trained pharmacists could also be someone who is working for the insurance company, and we'll talk about that in a few minutes, but they want to know about all of the medications you take, prescribed by all of the physicians, filled by all of the pharmacies, including all of your over-the-counter herbals, vitamins, supplements, and all of those that are used daily as well as those used as needed. This service can be performed in person or remote via the phone, or now we have telemedicine or video conferencing. When you go to get your complete medication review done, when you leave, you will have a complete medication list as well as a medication action plan. These 2 things I have pictures of. Here's what a medication therapy complete medication list might look like. The list should list the medication, the dose, when you take it, who prescribed it, and when did you start it. And as you age, you may start medicines and they get stopped for one reason or another. You should add the stop date to your medication list and why it was stopped. Sometimes it's stopped because you're starting a new medication that has a drug interaction and we want to stop it. but maybe 10 years from now, you're not taking that medication anymore, and we can restart it. And we would restart it, and it might be the better medicine for you, but if you don't remember why you stopped it, this can be some information that you include on your medication list that would help you in your future. So I encourage you to to write down why you stopped a medication and who was prescribing. And important to note, this list may not be the one that you use every day to fill your pill box because it's got a lot of extra information on it, but this is the list that you have with you when you go to the physician's office, so that when they might prescribe you a new medicine, they can look at this list and see what medicines you've been on before. But I do encourage you to write down all of the medicines that you take. If you take St. John's wort every day, then it should be on here, regardless of the fact that no one told you to take St. John's wort other than your sisters or your Aunt Gertrude. So all of the medicines that you take are important because, for instance, St. John's wort interacts with a lot of medications. And it's important to know that you're taking that medicine when other medicines are being prescribed. Or when we're thinking about why is this other medicine not working the way we expect it to work. It may be because you're taking a medicine that prevents it from working properly. A medication action plan is a list of activities that you can do. At the end of your complete medication review, you will have a list of things. The pharmacist will have come up with a list of actions that you can do. Seeing things like maybe the best thing you can do for your heart disease is stop smoking. So smoking cessation may be on there. If you have diabetes, maybe it's changing your diet a little bit at a time. If you're having some adverse drug event to a medication that's causing other problems, the list might be to talk to your doctor about this particular adverse drug event, or maybe the drug costs too much and you can't afford it and you're avoiding paying for it, you're avoiding taking it because it costs too much. Letting your physician know is really important. Sometimes the pharmacist can talk to the physician about these actions, and sometimes the onus is given back to the patient for them to make the discussion with the physician. Of course, no medication actions can happen without the patient and the physician agreeing to these new actions. So now let's talk a little bit about who pays for this service. Well, you're in luck. If you're over the age of 65 and on a Medicare Part D drug plan, the insurance company is paying for this. Why? Because they feel like they can lower their drug cost and hospital cost by having your medications reviewed by a pharmacist. In order to qualify, they do have some caveats. They want the people who are the most likely to benefit, those who have 3 chronic disease states. 3 chronic disease states might be someone with hypertension or high blood pressure, diabetes, and high cholesterol. Or you could have high thyroid or osteoporosis. There's lots of diseases. So if you have 3 disease states, you're taking more than 5 drugs that are covered by your Medicare Part D drug plan. So, and most people who have 3 disease states are likely to take 5 drugs. Those who are at risk or who are in a drug medication program for people who are taking opiates, those drugs, those patients also automatically qualify. And anyone who falls into the donut hole every year qualifies. So if you qualify, Medicare Part D pays for this service for free. And they actually have star ratings linked to whether or not complete medication reviews are done for their qualifying candidates. The star ratings are also linked to pharmacies. So sometimes you'll get a phone call or a flyer in the mail to say, hey, you qualify for this service. Or you get a phone call from the insurance company saying, we would like for your pharmacist to do this complete medication review for you. I encourage you to, if you are offered this service, it's free. Take it up. You never know where you can lower your drug costs and lower your adverse drug events and maybe decrease the number of medications you're taking. If you're not a Medicare Part D client, patients pay for this service, or adult, child, or caregiver can also pay for the service. How do you know about this service, or where do you find this service? You can find out information from your Medicare Part D drug plan program book website. Ask your pharmacist at your local pharmacy. Or there's also a program, ASCP, they have a website here on the slide that you can click on, and no matter what state you're in, it will direct you to a pharmacist that can provide this service for you. Okay, there's just a few scenarios that stick out in my mind as a medication therapy management pharmacist that I like to reiterate with you guys as caregivers. I did medication therapy management in the home. That meant I went out to the seniors' homes and looked at their medications, how they stored them, how they remembered to take them, and was astonished oftentimes. I went into one lady's home and she had a 30-gallon tub full of pill bottles that had pills in them still. And when I asked her which medicine she took, she pulled some of them out of this tub. So it wasn't like that was where she stored her meds that she doesn't take. This is where she stored all of her medicines. We should all be better stewards of our medicines. And if you're no longer taking the medicine, it really does need to be disposed of properly. Ask your pharmacist where to get rid of them. There are oftentimes DEA take-back programs where they will set up somewhere a tent and they'll take all of the medicines that you're no longer using and incinerate them for you. So ask your pharmacist where you pick up your medicines. How do you get rid of medicines you're no longer taking? It really is unsafe for them to be stored in the home. You never know. Maybe it leads you to be a target for a thief coming in looking for your opiates, or a child getting into medicines that they shouldn't be in and ending up in the hospital for some kind of drug overdose. So I really do encourage you to make sure that your medicines are stored properly. And by storing properly, we do not mean in the medicine cabinet in the hottest place, in your bathroom, where the temperature goes up and down as you take showers. Really should store them in a interior room of your house where the temperature kind of stays normal. It should not be in your glove box of your car or in your refrigerator unless the medicine says to keep in the refrigerator. Once again, your pharmacist, where you pick up your medicines, is your best source of information about where should you store these medicines and for how long do you store them. Some medicines do expire and they have expiration dates on them. You should not take medications after the expiration date. Another scenario that kind of is the whole, how do patients take their medicines? I had one lady, I walked into her house and she had like an ashtray, or an old like crystal bowl that she dumped her pills in at the beginning of the day. And as she walked by the pill box, she picked up one of her pills. So she had 12 pills in there, and some of the meds were 12 because she took a pill twice a day, and others were once a day meds, or maybe she had to take them 3 times a day. But whenever she walked by this candy dish, is what I called it, she would pick up a pill and take it and go on about her day. And at the end of the day, all of her pills were gone, so she took her meds for the day. The issue with that is the meds that she took twice a day, a lot of them they're all white pills. How do you know that you took the one 12 hours apart from the last one? And if you took 2 of those blood pressure medicines back to back, she might find herself a little dizzy that day or even on the floor because she dropped her blood pressure too low too quickly. So that is not the way to take your medicines. I've encouraged seniors oftentimes to use a pill box where they laid it out for the week. Caregivers, you can help with that by filling up a pill box once a week, and then have a time that this is the time I'm going to take all of these medicines. I had seniors oftentimes confused about whether or not they could take 2 pills at the same time. Are they going to interact in my stomach? No. If you're supposed to take medicines once a day, find the best time of day for you to remember to take their medicine. Is it at breakfast every day or is it in the evening? People have different understandings about when they should take their medicines, and this is something you should also ask your pharmacist when you're sitting down for that complete medication review. When is the best time to take all these medicines? Some medicines work better if you take them in the evening. Others work better on a completely empty stomach. And what is an empty stomach? Well, your stomach is empty 30 minutes before a meal and 2 hours after. So just because you haven't put the food in your mouth yet doesn't mean that your stomach is empty. So we have this range of 30 minutes before to 2 hours after when we talk about taking medicines on an empty stomach. one of the medicines that comes to mind oftentimes that people have trouble trying to figure out when to take is your thyroid medicine. Oftentimes, older adults take thyroid medicine, and they get up multiple times during the middle of the night to go to the bathroom. And one of those times when you get up in the middle of the night might be the best time to take that thyroid medicine, because then when they get up in the morning, they're hungry and they go get their coffee, they get ready to eat, your stomach's no longer empty. So, and waiting 30 minutes before you can eat breakfast is oftentimes not doable. So taking that thyroid medicine when you get up in the middle of the night might be a good choice. But how do you do that and know that you took it? Well, you put it in a pill box, that's the only thing in that pill box, and you sit it on the counter next to your toilet. And that way you can take that medicine when you get up. And in the morning, if you get up and the pill's still there, then guess what? You have to take that pill. So in conclusion, your pharmacist is your medication advocate. You should absolutely use them. When you go to see your pharmacist, ask to speak to the pharmacist when you pick up prescriptions. If you have questions about over-the-counter medicines or herbals, talk to them. That's what they're there for. And I assure you, they would much rather talk to you about your medications than answer the telephone that is always ringing. So in conclusion, some of the websites that I encourage you to use if you're a website savvy person, the www.drugs.com will help you find more information about the medications you're taking, the prescription drugs. The second link is for herbals and supplements. So if you have questions about the St. John's wort or curcumin or turmeric, lots of new evidence out there saying use these items for different things. You can look at these websites to find out information. And of course, the Medicare.gov website is where you would go to determine whether you're on the right drug plan for the medications that you have. You click on this link, it asks you, you don't have to put any information about yourself in other than your zip code, and you can put in the list of your medicines, and it will bring up the top programs that cover your medicines, and they rank them according to cost, how much it costs when you go to the pharmacy, as well as how much it costs when you have to pay your premium every month. And this is a list of references. If you have questions about the statistics or what have you, they're all there. Thank you.